Hello, viewers and listeners. You're welcome to another edition of the program Midday Vibes. Coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. I'm your host, Hajara Usman Attajul. Health workers are raising concern over the growing cases of suspected cerebrospinal meningitis in Kurawa village, which is in Sabon Birni local government area of Sokoto state. Reports say the victims, who are mostly children and young people, are dying within 24 hours of showing symptoms. Local clinics are seeing more patients while some deaths occur before reaching the hospitals. We are in meningitis season with the hot weather and the dryness. And the shocking part is that this disease can spread very, very fast. State health authorities say they are verifying the cases and responding accordingly. Meanwhile, the Sokoto State Commissioner of Health, Farouk Abubakar Wurno, say affected patients of suspected meningitis cases in Kurawa village are now responding to treatment. According to him, he has sent health workers and medical teams to the village to help manage and stop the spread. And also the deputy governor also visited the village, and residents are now happy with the quality of response. In today's edition of the program Midday Vibes, we will explore cerebrospinal meningitis. What is this disease? What are the early symptoms? What are the causes, preventive measures, as well as the treatment? To discuss this with me in the studio is Dr. Abdul Hakim Yusuf from Infectious Disease Hospital, Amanawa. Sorry. Doctor, you're welcome to the program.
Okay, thank you for having me.
Doctor, what is this cerebrospinal meningitis? How does it differ from malaria?
Thank you for this wonderful question. You are right that there is a high rise of cerebrospinal meningitis cases in Sokoto State due to the current harsh weather, dry conditions, and also other contributing factors such as poor personal hygiene, overcrowding, which almost contribute to the high rises of the meningitis cases in Sokoto State. So cerebrospinal meningitis is usually is a vaccine-preventable disease, which is characterized by inflammation of the left meninges. This left meninges are commonly referred to as the arachnoid and the fair matter, that is the covering of the brain. So usually, as the bacteria invade the submucosa, it gets into the bloodstream and travel to the CNS, where all the signs and symptoms will develop usually within 2 to 5 days. That is the incubation period of this the cerebrospinal meningitis. So it differs from malaria in the sense that the causative agent are totally different. For cerebrospinal meningitis, it is usually caused by infection with either bacteria, viruses, fungal, or parasite. And in some cases, there are other non-infectious etiologies, like somebody with diabetes mellitus, somebody with carcinomas, they can all have meningitis. In contrast to
The
malaria, which is most commonly caused by bite of an infected female Anopheles mosquito. So they are totally different. Their etiology are totally different, and even the affected in the human bodies are totally different. For cerebrospinal meningitis, the bacteria just affect the CNS, that is the central nervous system, while for malaria it only affects the blood and the liver.
Okay. So why is meningitis called a killer disease? Is it because it can kill someone within 24 hours?
Meningitis is called a killer disease because there are many things that people are afraid of. Number one, as the name suggests, cerebrospinal meningitis is it usually affects the brain and the spinal cord. So any infection that can have its way to the brain and the spinal cord have a deadly tremendous this thing. effect.
Exactly.
So usually we anticipate mortality to be high for those infectious organisms that can travel and reach with the brain and the spinal cord. So
That
most of
is.
the cases
Mm.
they don't usually last more than 48 hours or greater than 48 hours if left
Untreated.
untreated.
Yeah.
But most of the cases that have some most of the cases that present to but healthcare facility early, they tend to have a good recovery with little or no complications.
Okay. So can a child have a meningitis and show no fever? That's he might not develop fever.
Okay, according to
I,
the based on the etiology, and
mm,
also I forget to mention that
mm,
usually the symptoms vary across ages. That is
okay.
from infant to
Mm,
adolescent to
mm,
adult to elderly age. Usually for children,
mm.
the symptoms vary from that of adults. For
Okay.
children, they might present with unspecific symptoms. We have
Adults. Oh.
from adolescent, adult, or elderly.
Mm,
Usually in children, they usually tend to have fever,
mm,
vomiting. Some have poor feeding. Some younger infant may have bulging fontanelle or swollen fontanelle. Some may even have what we call paradoxical irritability. That is, a child
mm,
will remain calm when on move, but will become irritated if held. So usually in the adults, as
mm.
in contrast to adult, in adults they usually have a triad of high fever, a
Okay.
severe headache, and nuchal rigidity. So usually this is typical in adults, but in children they have unspecific symptoms. So
Mm,
a high index of suspicion is usually anticipated in such kind of age group.
okay. So what are the early symptoms that parents need to watch out for? Early symptoms of this cerebrospinal meningitis.
So the symptoms vary based on the
Like, well, like,
etiology.
okay.
That is the causative agent. If it is bacteria, viruses, fungi, or parasites, but
Doctor,
mostly in this region.
can you break it for us because this
Okay, to
terminologies, even me,
okay.
I'm struggling to understand.
In this region, we
Mm.
are in the tropics. So
Okay.
in the tropics, there is what is called uh, tropic
Meningitis.
meningitic belt.
Ah.
That belt stretches 5 to 15 degrees along the equator. So usually from the west we have Gambia, to the east we have Ethiopia.
Mm.
Then along the this thing, the meningitic belt, we have
Mm.
countries like northern Nigeria, Chad, Dahomey, and Ghana. They are
Mm.
all within this meningitic belt. So, in whole season, or the rest season, like this, the
Mm.
most commonly implicated
Yes.
agent that cause bacteria in this region uh, either Haemophilus influenza
Mhm.
or Streptococcus pneumoniae or Neisseria meningitis. But the one that is implicated in epidemic or outbreak is the Neisseria meningitis. While the strain has almost 12 but it has almost 12 serotypes. That
Okay.
is type A, C, up to the 12th one. So usually
Mm.
in children, they might present with fever.
Mm.
That's the most common presentation. Some might not present with fever, but
Mm.
usually they have hypotonia. They can remain in one place,
Mm.
not feeling, showing sign of apathy, and showing sign of uh, unresponsiveness. So that's
Okay.
the early sign that a mother can pick from her child and
Okay.
says that maybe this child is having meningitis.
Mm.
Unlike in malaria,
Mm.
they might present with
Fever.
projectile vomiting, high grade fever. But in this kind of cases,
Mm.
majority of the infant they don't present with a projectile vomiting. They only present with fever or low grade fever, and they can remain calm, showing unresponsiveness.
And in that aspect, I was expecting maybe you mention something like vomiting, and it's not part of the symptoms, right?
Vomiting is not among the classical
Yeah.
signs of meningitis. Usually, the
Okay.
classical
Mm.
signs worldwide is somebody with severe
Mm.
headache,
Mm.
high fever, and nuchal rigidity. These are the
Mhm.
classical triad of
So once the
meningitis.
parents notice some of these symptoms that you've mentioned, should they rush the child to the hospital, or they should? monitor the child for some hours.
So as a healthcare professional, we usually encourage all the mothers that if they suspect anything in a child, that they should rush him within the first few hours as early as possible. Because most of the times they might think otherwise, thinking it's another disease, they give paracetamol, they give other things, but they didn't. Most of the times, for those that have that uh, for those cases that result in either mortality or morbidity, they usually present late. So we usually encourage them to present late because we have a golden hour um, of intervention, that's treatment. So if a child present early, we can be able to administer the most sensitive agents and also watch out for other complications and also target them early before they manifest because they proceed into mortality.
Okay. So is this cerebrospinal meningitis contagious? Like if one child had this in the family, is it likely like other children in the family can catch it?
So cerebrospinal meningitis is highly contagious, highly contagious. That is why uh, part of the preventive measures we usually advise the community or the parent on to avoid
Overcrowded.
overcrowding in their
Okay, sleeping in
various houses in overcrowded place. Usually we encourage them to be sleeping in well ventilated area, and we usually encourage to bring their child forward for immunization or vaccine. So it's highly contagious because it usually they spread there. The can spread from our person to person, and usually can spread from nasal or throat droplet. So if one cough or sneezes or cheese something or use some equipment that we use in the house like spoon or plate or something can easily carry or
so another
or
person
get the
can
disease.
contract the disease.
Yes.
Okay, I get it now. You've mentioned that adults too can get this meningitis, right? So who is most vulnerable? Is it the adults or the children?
So for many of the diseases that we have that are highly contagious, usually the
The adults or the children?
children and also the elderly, they are at risk because of low immunity or their immunity is still very developed, unlike the adult. The adult have a
Fully developed.
very strong immunity that can withstand this bacterial invasion. But for the children and the elderly and also the immunocompromised, some that have an underlying condition, they are more vulnerable to this disease because they have weak immune system compared to the adult.
Okay, viewers and listeners, it's still your show, Midday Vibes, coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. We will take a short break and we will be right back. Please stay with us. Welcome back. In case you've just joined us, this is Midday Vibes, coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. And right here at the studio, we are discussing about cerebrospinal meningitis because there is an outbreak of suspected disease in Kurawa village, which is in Sabon Birni local government area of Sokoto state. And with me in the studio is Dr. Abdul Hakim Yusuf. He's from Infectious Disease Hospital, Amanawa State. Do you want to be part of this conversation or you have any questions to ask our doctor? The number to call is 090-6000-2022. Doctor, you are welcome back from the break.
Thank you.
Earlier, you've mentioned some of the symptoms that parents need to watch out for cerebrospinal meningitis. Now, looking at right now, we are in hot season. The weather is hot and everywhere is dry. Why does meningitis spread more in hot season? Though you've mentioned some terminologies earlier that I was struggling to understand. Can you throw more light on it?
Okay, thank you for this wonderful question. For meningitis, for every disease habit is time that usually is the number of cases rises. Usually the speed it is going at low altitude about almost 20 kilometers per hour. Unlike in the other season that it can reach as 80, 100. So usually in this season, it can easily irritate the throat and the nasal mucosa. So by irritating the throat and the nasal mucosa, these are organisms that usually cause meningitis. They can easily get into the blood stream. So from the that blood stream, they can easily get into the the CNS, which is the central nervous system, where it manifests its effect. So usually, because of the irritation of the throat and the nasal mucosa, this bacteria can easily get into bloodstream. And secondly, in Hamatan and dry season, people tend to be overcrowded in small places. So that is another this thing that contributes
Another
to
factor that contributes.
to the spread of this meningitis. Another thing in hot and dry season, usually there is reduced hygiene due to lack of water and basic sanitation. So also it also contributes to the spread of the disease in the
So,
dry season.
doctor, are there home remedies or traditional medicine that can work to cure this cerebrospinal meningitis, or hospital is the only way?
For now, we don't know. I'm not aware of any traditional medicine that do some wonders. What we usually tell parents is, if they suspect their child is having any disease, not even any disease, as they pick some symptoms early, if there are something that involve like fever and other things, they can give them antiparasitic, but they must manifest to the nearest healthcare facility as early as
As
possible.
possible. And that's what I'm about to ask you now. For parents that noticing some signs or symptoms of this cerebrospinal meningitis around 10 p.m. in their that's symptoms on their child around 10 p.m. and they are in a village. That village, maybe there is no hospital nearby. So are there any first aid treatment that they can provide to that child before morning and taking him to the hospital?
Okay, I don't think there's any village that doesn't have primary healthcare center. Some, I think across the 774 local government in Nigeria, I know the federal government has to try it is best on that primary healthcare under one roof to cover all the villages. So usually each village has a primary healthcare or ward per se has a primary healthcare center, and all this medication that you can use to treat meningitis, specifically the bacterial meningitis, are distributed to these centers and can be administered even by CHU or JCHU in those places. So usually there is no excuse for a mother to stay with her child at home, even if it's 10 p.m. The only thing they can arrange with somebody that can get them to that
Okay.
healthcare facility if they are far away. But however, they can still give the child antibiotic. If there's no antibiotic or any medication in the village, they're supposed to keep the child hydrated. That is by giving him food.
Enough
All of it
water.
is small child that he can suck. He will continue sucking. And also they can use a rag and also a water to
Okay, to cool down the
sponge
temperature.
the child to cool down temperature before reaching the healthcare facility.
So what drugs are used to treat cerebrospinal meningitis?
So in the first, there are various drugs that can be used to treat bacterial meningitis, specifically bacterial meningitis, because it's the one that is most commonly associated with outbreaks in this subtropic and the tropic region. So we usually use antibiotics, and these antibiotics usually they are we give in the olden days. We usually use antibiotics like penicillins and co. But now the mainstay of therapy we use this thing, and we use a antibiotics that can
Treat.
cover all the strain. So a broad spectrum antibiotics, I mean, can be used to target. Usually we use the third generation cephalosporins. They are the ones that are distributed. But in other cases of fungal or parasitic or viruses, although some viruses are self-limiting, but we can use other range of medication. And also there are some supportive this therapy that we give, like dexamethasone. If a child presents early or a patient presents in the first 24 hours, we can also give therapy, and also manage the spike in the temperature and other complications that might
All
arise.
right, all right, okay. Are these medicine that you've mentioned, are some of them available in Sokoto primary health centers, or is they are only available in big hospitals?
So the medication that I mentioned virtually are all available in the primary health care center. I think the state government have made effort to distribute all this medication. So
Mm-hmm.
they can find in every PSC and can be administered by every health worker there.
So if this in this disease, that is cerebrospinal meningitis, are treated early, can a child fully recover?
Yes, if the child presents within the golden hour less than 24 hours, the child
Mm.
can have 80 to 90% chances of recovering fully without
Okay.
any complication.
So what are the damages that can occur when treated late?
So for late presentation,
Mm.
there are various complications ranging from, we can divide the complication into cranial and extracranial. The cranial complications, they are complications that usually target the brain and the CNS, while the extracranial, they are the manifestation of outside the central nervous system. For the cranial complications, they can range from brain herniation to cerebritis to also cranial nerve
This
affectation that can lead to
brain what you mentioned.
herniation. That is, there's a brain stem and there's a hole. So
Okay.
that hole usually, if the brain, if there is risk in intracranial pressure, so the
Mm.
brain can herniate. So that herniation is like, we can say obstruction can obstruct there. So one is obstruct like you like somebody strangulate easily die. That's the same way. So for the brain, if it's strangulated in that ferment
Mm.
magnum, so somebody can easily lose control and can instantly die
Okay.
because it's the brain that controls everything in your body.
Yes,
So
yes.
when it is when it get strangulated in that
Mm.
foramen magnum, you can easily or instantly die. For the extracranial complication, I mean, also the most commonly this complication that we
Mm.
usually notice in this environment is the cranial nerve affectation. That is, somebody will present with uh, uh, deafness or hearing loss. That's the most
Okay.
common. But apart from that, there are various ranges of complaints that can manifest.
Okay,
Usually for
after
children,
the when it's not treated early,
when it's treated early, for
it can
somebody
lead
that
to
present
someone
like to
to
lose his own hearing,
hearing.
because the uh, part of the complication, like I mentioned earlier,
Mm.
is nerve affectation. That is the cranial nerve affectation,
Mm.
which some get their, which all of them or almost most of them get their branches from the brain. So that bacteria can still infiltrate around those nerves, damage them, and result in the hearing loss.
Mm.
Also, for the extracranial manifestation, we can have like somebody might also have low IQ and others. They can all present. Most of the child that usually tend to perform low in school, there
Mm.
is some are attributed to first history of this
Okay.
meningitis. Their first neurological sequelae, so
Mm.
might have low IQ and
Mm.
finding difficult to learn or
Okay, that
to
is that as is
compete.
slow learners.
Yes. So most
Okay.
of them, they are victims of
Mm.
the complications.
Okay. Earlier you've mentioned like there's vaccine for this meningitis, right? If I'm not mistaken. Then
Yes.
who should get it? Are they available for adults or children, or everyone can have access to it? And is it for free in Sokoto?
So the vaccine in the olden days, according to our routine immunization schedule that we use currently in Nigeria, we
Mm.
have a vaccine for the major the for the major strain that cause epidemics or outbreaks. That is the strain A. So it is incorporated into pentavalent vaccine, which there are almost 5 different diseases, including the meningitis that the vaccine was manufactured for. But now I think in last 2 years, around March 2020, Nigeria got Men 5CB vaccine,
Mm.
which target all the major 5 strain of this meningitis that usually cause epidemics or outbreaks, or that are commonly found in this our region. So that
Mm.
vaccine is available free, and usually from 1 year old to 29 years of age can get it at a
Wow.
free. Of course, I think in Sokoto, in Kebbi, and other states that are across that meningitis belt that I
Okay.
mentioned earlier. So I
Mm.
think all these vaccines have been distributed to these places.
You've mentioned that during heat seasons and dry season, that there is factors that can contribute to that high rising cases of this meningitis. So how can people? Can you mention some of the ways that people can protect themselves and their families from contacting this disease during this season?
So usually during the dry or hot season, people should try as much as possible to avoid overcrowded places like in market, schools,
Mm,
religious centers, and
mm,
other places. And usually even at home,
mm.
most specifically at home. Also, people should try to stay in hyper-ventilated space.
Okay.
Also, people should try to improve their personal hygiene.
Mm,
Also, people should try to get their vaccine as early as possible,
as possible.
especially if they get contact with somebody that is infected with the bacteria.
Okay. There's personal hygiene. Can you throw more light on it, like washing our hands regularly, or is it taking baths, or is it taking care of the environment entirely?
So it encompasses both to take care of your environment, take care of your personal hygiene, to wash your hand after shaking hands with somebody, after somebody eat or you want to drink with a cup. You have to make sure that
You
you
wash
what,
it.
and also by donning your face masks and other protective equipment, because
Okay.
most of these bacteria can spread via nasal droplet. As somebody is talking, as somebody is sneezing, as somebody is coughing,
Coughing.
you can easily get um, the
And
disease.
that's why I can. That's why you've mentioned that children are more vulnerable because their immune system are not fully developed. And you know, children are always playing on the around the surroundings and putting their hands into their mouths, like small childrens and toddlers that can are crawling everywhere. What advice can you give to their parents, especially the mothers,
So
in
for
that
parents,
aspect?
usually there is some behaviors that are very prevalent in this our society. Like some, if they carry your child, they can kiss him or give you.
Yeah.
All those are ways that those these small children can easily get the meningitis. Also, apart from it, you can see in a house that there is no specific room for children. They can be overcrowded in one small places, all of them together. Somebody is coughing, somebody is sneezing, so they can easily get the disease. So for children, they're supposed to be separated apart in a well ventilated place. And also, if somebody carry your child, you ask them, please don't do this. And also, you take care of them because the parents are the first line of defense against these children. So that they are usually the first that will act to prevent these children, because on their
Yes.
own they cannot.
Yeah.
So it's the duty of all parents to make sure that they watch after their children, and also encourage good personal hygiene for them and also for the entire family.
If there's parents listening to us, listening to our conversation right now, and the parents feel kind of scared, what's your message for them to make them feel to breathe easily?
So it's normal for somebody to be
Scared.
scared, because the way people are mentioning that if you get meningitis, you can easily die within
Within 24
24
hours.
to 48 hours if untreated. But the panic is not the main issue. As you, yeah, it's normal to be scared. But even if you get scared, the first thing is to look after your child. If it presents with any sign, any symptoms that you are not familiar with, or symptoms that maybe you give normal distant remedy that we usually encourage children, the caregivers to give, and the child didn't respond. So you carry him to a nearby healthcare facility early, and also encourage. I would like to use this opportunity and encourage the, the caregivers to carry their child for vaccination. It is free
Okay.
and affordable, and we, the doctors at the Sokoto State level, we are ready. We are more ready to offer our help to the victims of this meningitis.
Okay, so thank you very much, Dr. Abdul Hakim Yusuf from Infectious Disease Hospital. And thank you
I
for
highly
honoring our
appreciate for
invitation, and thank you for sharing your thoughts with us today.
you. Are highly, I really appreciate.
So, And with this, we come to the end of today's edition of the program Midday Vibes. On behalf of our production crew and our guest, Dr. Abdul Hakim Yusuf, I am Hajara Usman Attajiri. Stay blessed. Until next time.